Welcome back, everybody. Thank you guys so much for joining us. Please hit that like and subscribe button. It helps us so much. I'm your host, plastic surgeon, Dr. Bruce Hermann, and with me, as always, is the amazing Sarah.
Hi.
Hi, Sarah. In the box, Travis, how are you, buddy?
I'm good. How about yourself?
Everybody having a great Friday?
Yeah.
Cannot complain.
I apologize for keeping you guys late. I just actually went over in surgery a little bit longer than I thought I was going to.
We'll forgive you.
So
No, it's
we
okay.
can't banter too much today. We got to jump into segments.
Gotta do it quick.
Jump into segments. Are you guys ready?
Yes.
I think so.
All right.
I think so.
All right, first off, this one actually is one that I've been meaning to talk about for a while, and this is a segment about medical error deaths and the truth about what's real, like how big of a problem is this? Now, I know you guys are on social media, and I assume that you occasionally look at medical topics just because of our background here. Have either of you guys ever seen a article talking about the fact that medical error deaths is like a huge problem in the United States, or that it's like one of the biggest causes of death? Have you guys seen that? Okay.
I've not seen it.
Oh, cool. All right. Well, the reason I asked that is because I probably read a few more medical articles than you guys. Just with my
Maybe
job,
a little bit more.
just with my job, and since about 2016, there's been this kind of like this group of media outlets and people on social media talking about a specific article. And this article was in the British Medical Journal, which is obviously a very big publication.
Good deal.
And this journal article, and I think the next picture, Travis, I think is that journal article. Yeah, here it is. If anybody wants to look it up, from British Medical Journal 2016, medical error, the third leading cause of death in the United States. And this article claimed that medical errors cost 250,000 deaths per year, which would make it the third leading cause of death behind heart disease, which is 700,000, and cancer.
I wonder if it's gotten any better since 2016.
Well, so we're going to break all this down. So when this article came out, a lot of doctors were like, this is just absolute nonsense.
Yeah.
This just can't be real, right? Because we're in the trenches, we kind of know what's happening. But despite all the objection by physicians, like the media ran with this. And I got a couple articles from like really big publications. Travis, throw that up there, that picture, yeah. So Huffington Post, CNN, U.S. News World Reports, NPR, like everybody ran with this this headline of medical mistakes, third leading cause of death in the United States.
Pretty scary.
Well, yeah, and you're just like, well, why would somebody run with just this study? Well, the media is going to do it because it's shocking, right?
Yeah.
They're going to get clicks, and then I think a lot of the reason that social media had people posting is because there are a lot of alternative medicine people out there that benefits them if traditional medicine looks bad.
Yeah.
So there are people out there that would want to push this narrative, and so the first question they ask, okay, is this real or is this not real? And so before I kind of dig into this study, because it's kind of been broken down by not just me, but a bunch of people, I just want to talk about my personal experience with medical errors. I have to say, and I was thinking about this last night, I personally, in the 22 years I've been a doctor now, I personally haven't seen myself, a patient that I was caring for, that a medical error caused their death.
Okay.
I haven't seen it in 22 years. I've seen plenty of medical errors. In fact, they're not that uncommon. In fact, like you think about what kind of errors are there. Well, there's like active errors, like something you do, like you give the wrong drug, or maybe you're in surgery and you do something just grossly negligent and someone dies. And then there's errors of omission, meaning you miss something. I see that all the time. I get consulted for patients that have really complex stuff, and I'm like, oh, guys, this is the problem. Or like just the other day, I ordered a radiograph, and the radiologist missed something that I was looking for, and I picked it up. So, technically, those are medical errors. But, the question is, did they cause any harm?
Yeah.
Right? And so, I've seen plenty of medical errors, misdiagnosis. I've heard stories of people that I didn't necessarily were involved with their care, like, oh, this patient went, to the OR and this bad thing happened and they died and it was a medical error. Or I've heard of, people getting the wrong drug and dying. I just haven't seen it myself. So, right off the bat, if I've been in medicine 22 years, surely if that number was that big, I would at least have some personal experience with it. Because I have done trauma surgery, critical care. I've done things where where people have the chance to die because they're so sick.
Yeah.
So this is my own personal experience. Is like, yeah, there's no way that that's right. And so digging into that study, this study was looking at hospital deaths. Okay, so there's 750,000 deaths in the hospitals every year. A lot of people die outside the hospital, but this study is specifically looking at that. So according to this study, it's saying that 1 in 3 people in the hospital die from medical error. I mean, there's just no way that
That's a lot.
Even a layman could like look at that and be like, there's no way that's true. I mean, there's no way that 1 out of every 3 deaths in hospital is due to a medical error.
Are they saying like these people that have died just have had medical errors?
So that's kind of like what one of the problems is.
Yeah.
So digging into this study, first off, this wasn't a new study. Basically what it is, it looked at 4 previous studies that were pretty small, like, little groups of people in various places, and it tried to extrapolate that out into a national number, which obviously is not always going to work. And it had massively inflated numbers for a few reasons, because first off, it was looking at any type of adverse event, okay? So adverse event, if somebody has a drug reaction, that's an adverse event, and that was getting thrown into this is a medical error. Well, I mean, most doctors will tell you that, just because someone has an adverse event, number one, it doesn't mean it's a medical error. I mean, sometimes there are just adverse events that are that can't be prevented, right? It's unpreventable. And two, not all adverse events affect the patients. And so, as I was saying, I've seen a lot of medical errors, and I haven't seen anyone die from them. A lot of medical errors happen, but really don't weigh into what is the final outcome.
Right.
If somebody gets a wrong drug and the drug's harmless, I mean, yeah, it's a medical error. But then if they go on and they die from something else, that's how this study kind of inflated those numbers. Because they're just looking at any type of adverse event. Well, I mean, in very complex patients where you got tons of doctors working, tons of drugs going in, lots of procedures, lots of nurses, I mean, it's not unbelievable that maybe 1 out of 3 patients has some sort of adverse event. But the question is does that have any effect, on their final outcome? Right. And the answer is no. I mean, this is why I have a problem with a lot of studies out there, and this happened a lot, like, recently with the pandemic and other things, where like all these studies comes out and people just like glom on to like one sentence of the study and run with it like it's like that the God's truth.
People always cling to negative stuff. Anyways.
Yeah, right. Well, it's like, the media wants to like get clicks, and so, a headline like that, shocking.
Fear sells.
Yeah, exactly right. And then like I said, there's people out there that profit when modern medicine looks bad.
Yeah.
So there actually was another study, and oddly enough, this study, although it's much better, got like 0 traction. Why? Because it's not shocking. So it was a 2019 study. Throw it up here. I think I got it, Charles. Is that the next thing? Yeah, Association of Adverse Effects of Medical Treatment with Mortality in the United States. So this was from JAMA, Journal of the American Medical Association, which is one of the biggest publications here in the United States. So it looked at adverse effects of medical treatment, but it broke it down into 6 categories. So it had it as adverse drug events, surgical and perioperative adverse events. So that'd be like just regular complications from surgery. Okay. Misadventure. Okay, remember that one, misadventure. Adverse events of medical management, adverse events with medical surgical devices, and then other. So when you look at those categories and like what's involved with them, really the only one that most people would say is a medical error is misadventure. Okay. Like misadventure is like things I was talking about. Like, for example, if I'm going to give you a dose of pain medication and like the therapeutic dose is 2 milligrams, but I actually drop 200 and I give it to you and you die, that's a misadventure. Or if somebody does something like in surgery that's just not complication related, but just grossly out of bounds and you die from it, then that's a misadventure. And so when you look at that study and the misadventure, the percentage of people that had misadventures was just a tiny fraction of the adverse events. And so that's why that 2016 study can't be taken on face value, because it's looking at all these different categories of things that are not necessarily preventable and not necessarily considered medical errors, and saying these are all medical errors.
Yeah, so just like some bad data.
Yeah, really. It's just, or more like bad interpretation of the data. It's
uninformed data.
It's not like really digging down to, okay, is this preventable, and is this truly a medical error versus just like a complication of surgery that is a known complication. I mean, people have complications in surgery. It's part of medicine, right? Like everything has risks and it has benefits. And so if somebody has a complication, I mean, that's not a medical error. I mean, that's just the bad luck that patient had, that they're the 1 out of 100 that's going to get an infection or whatever.
Yeah.
So when you look at the misadventure deaths, and of course you'd have to extrapolate this out, the number drops dramatically, and it drops down to about 5 to 20,000, which to me sounds believable. I mean, I know that number's huge, and obviously it's something that since about 2000 hospitals and doctors have been working on. Like there's these quality initiatives now where like we seek out what medical errors are happening and how to prevent them. And what's also interesting about that 2019 study, it showed that the adverse events are going down. They're not increasing, they're actually getting better, which would make sense. We're getting smarter, we're learning where mistakes happen, and we're putting safeguards up to prevent them. So yeah, I mean, I think that 5 to 20,000 number, which obviously is a high number, but it's not 250,000. I mean, that's a ludicrous number. I mean, it's just hard to believe that anyone.
I wonder who sponsored that article.
I mean, people think that these articles are written by like these super high-powered, medical. I mean, I wrote articles as a resident when I barely knew, anything about medicine, right? Because there's a lot of people, like the grad students or the residents, even med students, that they'll be, I'm going to write a paper about this, and they can literally do it. And then something like this will come up where they interpret the data in a way that is a shocking title, and suddenly, everyone runs with it. I don't know who wrote that British Medical Journal article. And I'm not here saying that medical errors don't happen. I mean, that's not it. But like, it doesn't benefit the American populace to mistakenly believe that if they go into the hospital that there's a 1 in 3 chance that they're going to die from a medical. I mean, that's just ludicrous. It doesn't help. I mean, it fosters mistrust of people. I mean, it's good for people to go to the doctor. If the population is scared to go to the doctor, then they're going to be less healthy than if they regularly went.
Right.
And so I mean, with the whole pandemic thing, doctors were catching flack about all that, and so I mean, things like this just aren't helpful.
No, not at all.
They're not. So yeah, I mean, I've always wanted to kind of dig into that, and so yeah, I went and pulled it all, and kind of looked at all that, the data about that being that British Medical Journal, and yeah, it's just not true. I mean, it's just flat out wrong.
Yeah.
So now
you know the truth.
Now you people know the truth about medical errors, that despite that 2016 study from British Medical Journal, medical errors are not the 3rd leading cause of death. They're not even close. I mean, it's going to be like way, way down at the bottom. And medical errors do occur. We know that. Hospitals and doctors are working with quality initiative programs to learn about when these medical errors occur and how to fix them to make sure that you guys are safe. So
absolutely.